I think we will start. So, good morning, everyone. Bienvenidos, bienvenidas. For those who don't know me yet, I'm Mirka, Cikkelova, the General Secretary of the European Patient Safety Foundation, and I have the pleasure of being your guide throughout today. It's wonderful to see so many of you here, all united by our commitment to patient safety and quality of care across Europe. Thank you for coming or connecting online, ready to share your knowledge, experience, and wish to learn together. Before we dive into today's agenda, please let me take a moment to acknowledge the recent events here in Spain. Our thoughts are with the communities affected by last week's devastating floods, especially those of you who have family and friends impacted by this tragedy. Events like this remind us the delicate connection between our environment, our shared well-being, a relationship where we all are responsible for nurturing and protecting. Today's conference is designed for each of you, recognizing the challenges and dedication needed to make patient safety a reality, whatever your position, whatever your environment. Among you, we have doctors, nurses, patient safety and quality of care officers, academics, researchers, legal experts, hospital managers, representatives of patient organizations, scientific organizations, life sciences, pharma industry, and also insurance companies. Welcome, everyone. I'm fortunate to know many of you personally, and also about the work you are doing every day. Pushing for change and striving for quality isn't easy and can sometimes feel lonely. But being here together reminds us the power of collective action. Let us use today to inspire one another, build connection, recharge batteries to be able to drive patient safety forward. Today, we are more than 150 participants from 21 different countries, and I believe this broad attendance reflects the European dimension of this meeting. Because this conference is not only about discussing key patient safety issues and sharing the latest updates in our field, it's also a place to strengthen the network of organizations and experts across Europe, each dedicated to improving patient safety and quality of care. It's about being part of a large, supportive ecosystem. One of our main aims today is also to bridge the gap between the European and local perspectives. By bringing together people from diverse countries, we can identify common and specific challenges, highlight the best practices, and explore new ways of working together. In 2022, we had the opportunity to explore the local realities of Sweden at the invitation of Focus Patient. Last year, we were in Austria, together with Medical University of Vienna and Austrian Platform for Patient Safety. And this year, we are delighted. Okay, one back. We are delighted to be here in Spain together with SECA, FIDISP, Censar, and Fisabio, and to welcome our Spanish attendees who represent over half of today's conference. Your strong presence is essential in grounding this event in a local context, connecting us to the reality of care in a specific place and time. And another essential contribution I would like to recognize is the support from our industry affiliates and sponsors, making this day possible. Thank you for standing by our side and for your commitment to patient safety. And now it's my pleasure to introduce the representative of our co-organizing institutions who have worked together with us to prepare this day. Our collaboration was intense, very happy, I can say, and hope today will reflect the energy and dedication we have invested, all of us, in preparing this conference. And now it's time for the traditional welcome messages from the representatives of the organization. And please let me introduce you first, Mrs. Inmaculada Mediavilla Herrera, President of SECA.
Muchas gracias, Mirka, por la presentación. Penilla, Santiago, en representación de FIDISP, Irene, en representación de Censar, María, en representación del Ministerio de Sanidad. Queridos compañeros y amigos, represento a la Sociedad Española de Calidad Asistencial, la SECA, que es una sociedad científica de carácter multidisciplinar cuya misión es impulsar la mejora continua de la calidad asistencial en el ámbito sanitario para que los resultados de la atención de salud correspondan a las necesidades de la ciudadanía. Nuestro principal objetivo es promover el compromiso de los profesionales y las sinergias entre gestores, proveedores de servicios, sociedades, colegios profesionales y administraciones públicas para fomentar la mejora y la innovación en la gestión de la salud. Por lo tanto, no dudamos cuando desde la Fundación Europea para la Seguridad del Paciente se nos propuso coorganizar este encuentro en Madrid. Y no solo no lo dudamos, sino que además la SECA se ha afiliado recientemente a esta fundación de la que anteriormente ya había respaldado algunas iniciativas, como la campaña Fighting Fatigue Together, lanzada en 2023 para concienciar a la sociedad sobre la fatiga laboral que sufren cada vez más los profesionales
fatigue that healthcare personnel suffer, and to fight this problem, looking for a safe environment for the patients. Thank you very much for the Foundation and Mirka Stefan for these past months working together in meetings. We had a lot of fun. Mirka said they were very happy. Okay, a little bit of Spanish, French, English. That was a lot of fun, yes. So it is truly an honor to welcome you to Madrid on an issue that pertains to all of us, patient safety, under the logo of digital transformation for the improvement of patient safety. What are we missing? We're going to discuss advances in this area and also to face the new challenges that technology is introducing. The World Health Organization has the Global Plan for Patient Safety 2030 and discusses in strategic objectives 1 and 2 to turn down avoidable damage and avoidable harm to zero with an attitude, a mental change, and then full mindfulness and consciousness of healthcare being provided everywhere. And it talks about building high reliability healthcare systems that protect patients daily against harm. Nowadays, technology has radically transformed healthcare, telemedicine, data management system. All these innovations allow us to be much more efficient and personalized. Thanks to technology, we can monitor on real-time basis, access instantly critical information, and in the end, save more lives. However, with the new advances, we have new risks. The technology that helps us improve healthcare can jeopardize the safety of a patient. Mistakes in the medication, breaches of privacy, the safety in the mechanisms are the new challenges. Together, we will explore through the different roundtables and workshops to maximize the benefits of technology while minimizing risks. It is essential to work together, sharing experiences so that we create a setting where the patient safety is always a priority. I invite you to ask questions, to share perspectives, because together we shall be able to build a future where technology and patient safety go hand in hand, guaranteeing that every person that trusts in us receives deserved healthcare and attention. Thank you.
Thank you, Inmaculada. And now the floor goes to Santiago Tomás Vecina, the General Director of FIDISP.
Good morning, and thank you very much, Mirka and Stefan, and my esteemed friends, ladies and gentlemen and guests. It is an honor to welcome you on behalf of the Foundation for Investigation, Teaching and Innovation of Patient Safety. It is known as FIDISP in Spain. And it is a landmark, this meeting, because of the international projection and also because it is hosted by Spain. Spain has a very brilliant tradition in the adoption of measures for patient safety. Please allow me to apologize for our director, Maricruz Delgado, because for professional reasons is visiting the hospital, but will attend later. She's participating in a roundtable. She just asked me to introduce you in her place. I would also like to explain what FIDISP is. It is a non-profit private organization. We're a foundation of 12 years existence, and it was created by healthcare professionals and non-healthcare professionals with a common goal: work for the improvement of patient safety and improving the healthcare and risk management. We train mostly professionals. We counsel and advise organizations in the risk management and patient safety plans. We promote investigation and innovation in this field, and in general dissemination of the culture of patient safety, both in society at large and in the healthcare setting. At FIDISP, we believe firmly that this event is a unique opportunity to exchange knowledge, as I said, and to explore a diversity of avenues that strengthen our common purpose. When we received the proposal of the European Foundation to be part of it, we said yes immediately. It was a great opportunity to share amongst all of us knowledge, ideas, innovations, and that it was a great opportunity just to be present here. We have experts from different countries, and I'm sure it will enrich our perspective, and we will learn from very innovating approaches and the best practices in our sector. I'd like to underscore one of the issues of today's meeting, particularly something that Inmaculada has said: the crucial role played by the new technologies, telemedicine, artificial intelligence. The new tools are transforming healthcare systems, and they open the doors to quality improvement and risk reduction. However, as we adopt these advances, we all need to be committed to a critical assessment in order to guarantee that innovation truly improves safety and do not entail new future risks. I won't take any longer. On behalf of this, thank you very much to Mirka and Stefan for this great opportunity. We have 3 of our expert members will also be part of the roundtables, and I do hope that the debate and discussions will inspire us to go on working to a healthcare more humane and safe every day. Thank you. Thank you very much.
Thank you, Santiago. And now let's hear to Dr. Irene Leon García, who is president of the Spanish Notification System for Safety in Anesthesia and Resuscitation from SENSAR.
Good morning, dear colleagues. Welcome you all to the Patient Safety Conference. As a president on behalf of SENSAR, thank you to the European Patient Safety Foundation, the organization of this conference. It has been a pleasure to be able to collaborate together. SENSAR is a non-profit organization dedicated to promoting patient safety in the surgical process. Over the past 15 years, SENSAR has grown significantly, becoming a leading voice in patient safety in Spain. SENSAR's journey began in 1999 here in Madrid. What started as a local initiative to improve patient safety in anesthesia quickly evolved into a national and international network. Today, SENSAR is a robust platform that connects healthcare professionals from over 130 hospitals across Spain and Latin America. As healthcare providers, we are entrusted with the responsibility of safeguarding the health of our patients. This conference is a testament to our collective commitment to excellence and continuous improvement in patient care. I encourage you all to actively participate in this conference, share your knowledge, ask questions, and engage in meaningful discussions. Together, we can create a safer healthcare environment for all. Finally, I want to thank each and every one of you to attending this conference. Your dedication to patient safety is inspiring. I'm confident that together we can make a significant difference in the life of our patients. Thank you and enjoy the conference.
And now let me invite Penilla Gunther, the president of the European Patient Safety Foundation, for the last welcome speech.
Thank you so much, Mirka, and thank you to all of our collaborating partners that we have heard here from the beginning. Thank you so very much. I'd also like to remind us why we're here. Some facts and figures from the World Health Organization states that 1 in 10 of patients is harmed in healthcare. 1 in 10. 3 million people dies every year due to harm and unsafe care. 3 million people. According to Sweden, where I come from, it's a third of our country should die, actually, from being harmed in healthcare. 13% is the direct cost of treating people who have been harmed. And 50% of this harm in every 20 patients is actually preventable. And you can also see that there are 3 types of incidents that is the 90% of all these harms in, for example, primary care. It's problems with diagnosis, there are medications-related errors, and of course, delayed referrals. But there are so much more in patient safety that we all are involved in one way or another. And according also to the World Health Organization, the total cost is $13 trillion for harm in healthcare or harmed patients. You can imagine what we can do with all this money if we were handling patient safety issues right. And to learn also people, individuals, to treat themselves right, to handle medication right, and all the new devices that are for self-monitoring and so on. So we do have a mission. I would like to point that out from the beginning. We're here on a mission to make healthcare more safe for us all. And this is all about the patients. And anyone can be a patient. So let's do it today to make a progress for patient safety in Europe or wherever we are working. So I would like to, for once, use my presidential authority to open this annual patient safety conference in Europe open. And it's also my honor to introduce our keynote speaker. It's Dr. María Fernández García, the Deputy Director General for Quality of Care from the Spanish Ministry of Health. Very welcome.
Good morning, everyone. Thank you, Stefan and Mirka, for invite the Minister of Health of Spain. Buenos días, compañeros, compañeras, colegas, y gracias a todas las personas que están conectadas online en esta conferencia internacional del paciente, de seguridad del paciente.
Patient
Para mí
safety.
es un gran honor.
To me, it is a great honor to be here today, representing the Ministry of Health of Spain. It is very interesting to discuss what we've been doing for many years in Spain as far as patient safety is concerned. To give us a context, many of you are familiar with this, but we're going to provide some data. The Spanish population is nearly up to 49 million inhabitants. All residents in Spain have universal access to health care. It is the protection of our health is an acknowledged right. We are 2 years above the European figure of life expectancy. It is a universal national healthcare system, financed public taxes, and we always look for equity in healthcare. It is decentralized in management into 17 autonomous communities and the 2 cities in the north of Africa, Ceuta and Melilla. We have a primary care level with 3,000 healthcare centers and 10,000 ambulatory offices. This year, we have cared for 257 million medical visits, 156 nursing, 100 million of tele visits, and many more than I cannot mention. The second level of attention, hospital care, we have 449 hospitals that roughly represent 115 beds. On a yearly basis, they deal with 4 million admittances with an average hospital stay of 7.8 with 3.5 million surgical operations, so that you have an idea of the enormous possibilities of harming patients that we can find within our system. This all is governed by our General Act on Healthcare. In 2003, we had the Cohesion and Quality Act of the National Healthcare System, setting up the needs for cooperation and administration of public healthcare as a means to ensure our citizens the right to protect their health, with a common objective of guaranteeing quality, equity, and the social participation in the national healthcare system. And specifically referring to quality, in the articles you see in the slides, this refers to the quality plans of healthcare system, external assessment and integral healthcare plans with reference to quality indicators, clinical guidelines, and the notification system of adverse events. Patient safety is an essential dimension of healthcare. It entails developing strategies to reduce unnecessary harm to the patient as related to healthcare provision. Spain, as it couldn't be otherwise, has been working in this line for many years, following the guidelines of the international organizations. Already in 2006, the Ministry of Health started developing the strategy on safety with the launching of the quality plan for the national healthcare system. And then it was extensively developed and regulated so as to design a strategy 2015-2020 has been assessed in 2021. And you could tell me, okay, you're late with the second assessment. Well, we're updating the strategy now, and it will be published next year. The principles of patient safety are commitment, coordination, execution, and evaluation. And the main tool is networking, linked to the councils of healthcare of the autonomous communities that are in direct contact with the healthcare centers. To the future, we must strive for an improvement of the quality cycle. So we have some strategic lines as marked by the Act and international recommendations and the needs detected by the different autonomous communities and other stake parties. So all the strategic lines that you can see here, I'm not going to read them, set objectives where recommendations are needed. We have 6 strategic lines that you can read in the slide. During the implementation process of the strategy, we have found, as it couldn't be otherwise, with facilitating elements, but also certain obstacles hindering the implementation. As facilitators, we must mention the coordinated work undertaken by the Spanish Ministry of Health with the local governments, the healthcare centers, the active work of the technical institutional committees that do reach a consensus. I know it sounds impossible, but we do reach consensus. The outcome are the strategic plans, and under close cooperation with the leading scientific societies that know about the matter. And there are barriers and obstacles that we need to overcome. First, there is no clear leadership between the patients' associations. We don't have a legal cover for professionals well established to protect professionals when errors are reported. And we need to deal with the culture, the needs for training, workshops, and education. We're working on it. The evaluation and the report was published in 2022, and the main objectives of the strategic lines are measured through the indicators under consensus, which are representative and standardized and validated. Here you can see the methodology for assessment that we have employed. It is multifaceted with many sources of information. And to the right, we have the semaphore code, and some objectives have been attained and others need further research. For example, the use of protocol in the safe use of medication. And I want to focus mostly on this second strategic line, safe clinical practices. Some of the more successful programs have come from here in our general strategy for patient safety: hand hygiene, safe use of medication, safe use of ionizing radiation, and programs for the prevention of infections at the OR, the ICU, and principles for the prevention of infections in the general uses of social and healthcare centers. As to the critical patient safety program, we have the application of different preventative measures as a bundle with proven evidence to prevent the infections associated to invasive techniques and devices and the acquisition of multi-resistant microorganisms during the ICU stay. We have 4 programs that have been progressively implemented, and that 200 ICU units of the healthcare system in Spain are joined. And we set some objectives for each of these programs. I don't know if I can use the pointer, but you can see as of March 2024, we have 37 hospitals for bacteremia, 0, 33 for pneumonia, 0, and another 30-something for resistance, 0. The success of this program, cooperating with the scientific medical societies, is seen at the charts. The pandemic obviously had a negative impact on the descending trend of the infection rates. This is all published, of course. Transparency is very important. At the Ministry of Health, we publish everything. And a book was published last year, and you may query at the website of our Ministry of Health. We also include training of our professionals, and the numbers give us an idea of the interest in attending these courses. Hand hygiene program. Well, 30% of the infections associated to healthcare are preventable by means of programs of hygiene and infection control. Yes, infection. So the Ministry of Health, within the framework of patient safety in the national healthcare system, promotes and fosters the dissemination of this hand hygiene program. We have different actions you can see on the slide. For communication purposes, we have the campaign of the World Hand Hygiene Day. We also make available self-guided training course for training, and we have an annual indicator report as a control. And this week we have published the one corresponding to 2023. In these reports that I mentioned, we can observe that after the implementation of the strategy, the results and outcomes have improved, as you can see in all charts, but we also have seen this increase during the pandemic. After the year 2023, the data don't show a favorable advancement, so we need to increase an awareness. This is an alert inviting reflection because there is room for improvement, both on the side of healthcare professionals on a daily basis and for us for the implementation of the practice of hand hygiene a habit, and the need for the centers to be more committed in their leadership. Safe medication. We joined the third challenge of the WHO for safe medication with 3 priority areas: high-risk medication, safe medication in polymedicated, and safe medication in transition periods. The strategy objectives on the safe use of medication include, amongst many others, foster electronic prescription assisted by proven effectiveness of decision-making tools, the conciliation and checking up of the medication during transition, promote the training of healthcare professionals and patients as well in this field. And what is very important to us is the reporting and notification of medication errors. The tool we use in Spain for notification in Spain is SINASP. This is notification and learning system for patient safety. And the main objective is the improvement of safety of the patients, analyzing problems and incidents or events or incidents that led to harm or could have led to harm to the patients. It is a main strategy, a priority to notify these events. The Ministry of Health, together with the autonomous communities, work at this SINAS system. It is a voluntary notification system, non-punitive, confidential, and we can report anonymously. And there's an analysis for learning and implementing the improvements locally. And so we register different events, incidents, the near misses, without harm, and also adverse events. Here is the depiction, the visual depiction of the system. This document is also available at our website. And we can see that the incidents more frequently notified are related to medication and the organization, management, and resources. Those are the 2 main causes you can see there. And currently our strategy, as I mentioned, is improving. We're going to publish shortly the update of the strategy. In the new update, we'd like to add a new general objective in strategic line 2 of safe clinical practices, which are the do not do recommendations, no hacer in Spanish. We follow guidelines based on scientific evidence, and the objective is that the professionals and users read the recommendations, abandoning low-value clinical practices because it doesn't entail a known benefit to the patients or because it endangers the risk of them being damaged or that it's a waste of resources. This is a dire need nowadays. We are being flooded by information and misinformation, both patients and professionals. There's too many fake news, and it gives rise to the so-called infoxication, and of course it increases the likelihood of incidents and adverse events. I was missing a slide. So in the long run, we will change the culture. We will overdiagnose and overtreat, and so it will make very evident that we will need measures to realign our situation in order to improve truly the patient safety. I'm sorry, I'm pressing the other way around. There was a recent survey that has just been published by SECA and FIDISP, where the Ministry of Health participated in the motivation and dissemination through the different local governments. We have seen that at the first level of care, in primary care, we need to focus very strongly because it has been proven that the outcome and the degree of knowledge of patient safety at primary care is lower than at hospital care. So the perception of the culture of patient safety amongst professionals of primary care in Spain needs teamwork, appropriate follow-up of our patients, a good organizational and communication system that is well structured. So obviously, we must pay attention to primary care as well in order to decrease medication errors, diagnostic errors, and especially to be able to promote the culture of patient safety. So thank you very much, and I hope you have a fantastic meeting. I'd love to attend, but we need to work on this and many others at the ministry. Thank you very much, everybody.